The pill your doctor prescribed to protect your heart may be the exact reason your heart is struggling right now. I know that is a hard sentence to hear, but I need you to stay with me, because what I am about to share with you is something most physicians were never taught in medical school, and what the research has been quietly confirming for over a decade. This is not a scare tactic. This is a conversation that is long overdue. Here's what I want you to picture. You wake up in the morning, you take your medications faithfully, the ones your doctor prescribed, the ones you have trusted for years to keep you safe. Maybe some mornings you feel a slight heaviness in your chest. Maybe your ankles are a little swollen by evening. Maybe your energy is lower than it used to be, and you chalk it up to getting older. But what if the aging is not the problem? There is a biological process happening inside your arteries right now, triggered not by what you are failing to do, but by what you are faithfully doing every single day, that conventional cardiology has been dangerously slow to address. It does not show up on standard blood panels. Most doctors will not bring it up at your next appointment, and it is affecting millions of people over 60 right now. By the time this video ends, you will know exactly what it is. Do not leave before we reach number 1. That single revelation may change your morning routine permanently. Margaret was 67 years old, a retired school teacher with silver hair she wore in a practical bun, and she had done everything right. For 11 years, she had taken her blood pressure medication without missing a single dose. She walked 30 minutes every morning without fail. She ate oatmeal for breakfast because her cardiologist told her it was heart healthy. She tracked her numbers. She attended every follow-up appointment. By every visible measure, she was a model patient, doing everything medicine had asked of her. Then she had a minor stroke. Not a catastrophic event, what physicians call a TIA, a transient ischemic attack. Temporary, recoverable, but deeply frightening for a woman who had spent over a decade believing she was protected. And what her medical team could not fully explain was why it had happened. Her blood pressure was controlled. Her cholesterol was within acceptable range. There was no obvious trigger. What they had missed, what nearly every physician missed for over a decade, was that one of the medications Margaret had been taking since her mid-50s was quietly depleting a compound her blood vessels needed to remain flexible. Not dramatically, gradually. The way a garden hose develops invisible cracks long before it finally bursts. We made one targeted adjustment, removed one medication, replaced it with a clinically supported alternative, and added a single precise nutrient. Within 4 months, her vascular inflammation markers dropped by 34%. She has not had another cardiac event in 3 years. What happened to Margaret has a precise clinical name. It is called drug-induced nutrient depletion, and it is one of the most consequential and under-discussed mechanisms in modern cardiovascular medicine. Here is the biology. Certain medications, particularly those taken long-term, interfere with the body's ability to absorb or synthesize specific compounds that your cardiovascular system depends on for basic daily function. Think of your arteries like rubber tubing. To do their job, they must remain elastic, expanding and contracting with every single heartbeat. The compound responsible for maintaining that elasticity is CoQ10, coenzyme Q10, a molecule your body produces naturally, but produces significantly less of as you age past 50. Statins, the cholesterol-lowering medications taken by over 35 million Americans, directly inhibit the same biological pathway your body uses to manufacture CoQ10. This is not an obscure side effect buried in a footnote. It is a predictable, well-documented biochemical consequence of how these drugs work. A landmark study published in the American Journal of Cardiology found that patients on long-term statin therapy had CoQ10 levels up to 54% lower than age-matched individuals not taking the medication. 54%, in the very patients presumed to have the most protected hearts. And here is what makes this more serious than most people realize. CoQ10 depletion does not simply reduce your energy levels. It directly impairs the mitochondria inside your heart muscle cells. Your heart beats 100,000 times every single day. Every beat requires cellular energy. When the drug designed to protect you is quietly starving your heart of the fuel it needs to function, the consequences are not theoretical. They are happening right now. I am Dr. Amadi, and for over 2 decades, I have worked with patients whose health did not meaningfully improve until someone was willing to look at the complete picture, not just isolated lab numbers, but the full interaction between their medications, their biology, and their daily life. What I just described to you, drug-induced nutrient depletion, the CoQ10 mechanism, the gap between what standard cardiology measures and what is actually happening at the cellular level. This is the kind of information that rarely makes it into a 15-minute appointment. Not because your doctor does not care, but because the system was not designed to deliver it. That is exactly why this channel exists. Every week, we break down the research that matters most to your health after 60, in plain language, with practical applications you can act on the same day. No jargon, no condescension, just the information you deserve to have. If you are not subscribed yet, I want you to do that right now. Not as a favor to me, but because what we cover here has the genuine potential to add functional, pain-free years to your life. The kind of years where you are present, mobile, and in control of your own health decisions. Now, let us get into the 5 pills. We are counting down from 5 to 1, and I promise you, number 1 is the most counterintuitive finding on this entire list. Number 5, the morning ritual that is slowly stiffening your arteries. The pill. Proton pump inhibitors, PPIs, omeprazole, pantoprazole. The capsules millions of people over 60 take every morning to manage acid reflux. PPIs were designed for short-term use, 8 to 12 weeks maximum. The majority of long-term users have been taking them for years, some for decades. And here is what that extended use does at a biological level. PPIs reduce stomach acid. That sounds harmless until you understand that stomach acid is the primary gateway for magnesium absorption. Magnesium is not optional for your cardiovascular system. It regulates heart rhythm, controls blood vessel tone, and maintains the flexibility of your arterial lining. Without adequate magnesium, arteries stiffen. Heart rhythm becomes irregular. Blood pressure climbs. A study published in PLOS1 analyzing over 350,000 patients found that long-term PPI users had a significantly elevated cardiovascular mortality risk, independent of age, weight, and pre-existing conditions. Practical application. If you have taken a PPI for more than 1 year, discuss a supervised taper with your physician. In the interim, 300 to 400 milligrams of magnesium glycinate taken in the evening has clinical support for partially offsetting the depletion. Number 4, the safe pain reliever, quietly raising your blood pressure. The pill, NSAIDs, ibuprofen, naproxen, used regularly by 60% of adults over 60 for joint and back pain. NSAIDs block COX2, an enzyme that also regulates blood flow to your kidneys. Suppress it chronically, and your kidneys begin retaining sodium, which elevates blood pressure and places sustained mechanical stress on arterial walls. Data from the New England Journal of Medicine shows regular NSAID use increases acute cardiovascular risk by up to 19% beyond 90 days of consistent use. Practical application. Ask your physician about curcumin with piperine, 500 milligrams twice daily with food, as an evidence-supported alternative for inflammatory pain without the sodium retention mechanism. Number 3, the sleeping pill nobody warned you about. The pill, benzodiazepines and Z-drugs, lorazepam, diazepam, zolpidem. Widely prescribed for anxiety and sleep disorders in adults over 60. These medications do not create natural sleep. They induce sedation, suppressing REM sleep, the phase during which your cardiovascular system performs its most critical overnight repair. During genuine REM sleep, blood pressure dips, heart rate slows, and your body clears inflammatory proteins from circulation. Sedatives blunt that entire process. Research published in JAMA Internal Medicine found that adults over 65 using benzodiazepines regularly had a 51% higher cardiovascular event risk compared to non-users, a figure that compounded with duration of use. Practical application. Ask about a supervised taper. Simultaneously, 0.3 milligrams of melatonin, not the commercially popular 5 or 10 milligram doses, which are pharmacologically excessive, taken 30 minutes before bed, supports natural sleep architecture without suppressing cardiac recovery. Before number 2, I want to hear from you directly. Drop your age and the one symptom bothering you most in the comments below. Fatigue, breathlessness, joint pain, poor sleep, whatever it is. I read every comment, and your responses genuinely shape what we cover next. This community is how better health information reaches more people. Number 2, the blood pressure pill with a hidden long-term cost. The pill: calcium channel blockers, amlodipine, diltiazem. These medications relax arterial smooth muscle effectively in the short term. The long-term concern is subtler. Chronic use can gradually reduce the cardiovascular system's independent ability to regulate vascular tone, creating physiological dependence on the medication to perform a function the body was designed to manage naturally. Research from the European Heart Journal found measurably reduced endothelial function in long-term calcium channel blocker users compared to patients managing hypertension through lifestyle and targeted supplementation. Practical application. Consider discussing nattokinase, 2000 FU daily, with your physician. This clinically studied enzyme supports arterial flexibility and may, over time, support a medically supervised dosage reduction. Before I reveal number 1, the item I have been building towards since the beginning of this video, I want to make sure you leave here with something you can actually use today. I created a free resource called the Senior Body Reset Guide, specifically for people navigating their health in their 60s, 70s, and beyond. Not a generic wellness brochure, a targeted, practical document built around the exact mechanisms we have been discussing. Inside, you will find a complete breakdown of the top nutrients most commonly depleted by long-term medication use after 60, with specific replenishment protocols for each one. You will also find a 10-minute morning cardiovascular routine requiring no equipment, designed around vascular flexibility and heart rhythm support. And there is a dedicated section on how to approach a medication review conversation with your physician, the specific questions to ask, the studies worth referencing, so you walk into that appointment informed and prepared. I update this guide regularly as new research becomes available. Right now it is completely free. The link is in the description below. Download it before you forget. It takes 30 seconds, and it may genuinely be the most useful thing you do today. Now, number 1. This is the one I want you to pay very close attention to. Almost no one over 60 has been told this directly, and I have been waiting until this exact moment because you needed everything before it to fully understand what I am about to say. 10 minutes ago, you believed the medications in your cabinet were protecting you without condition. Now you know something different, and that difference is everything. You know that long-term PPIUs depletes the magnesium your arteries depend on for rhythm and flexibility. You know that NSAIDs elevate cardiovascular risk through a sodium retention mechanism most people have never been told about. You know that sedatives suppress the overnight cardiac repair your body was biologically designed to perform. You know that calcium channel blockers used indefinitely can quietly reduce your vascular independence. And you know that the aspirin millions of people take each morning as an act of love toward their own heart carries a risk profile that the research has now clearly defined, and that most people have never had properly explained to them. That is not a reason for fear. That is a reason for a conversation, a real one, with your physician, armed with specific information and specific questions. In our next video, we are covering something almost no one in the health space is addressing directly: the relationship between nighttime urination frequency and early kidney decline in adults over 60. The most surprising finding involves a common beverage most doctors actually recommend. You will not want to miss it. The Senior Body Reset Guide is linked in the description. One click, 30 seconds. Your body has been waiting for this level of attention. You are not simply aging, you are still becoming. And the most powerful health decisions you will ever make, you can still make them today.